Hello nurses and future nurses, welcome back to my YouTube channel, and on today's episode of Nurse Clement B, I am going to teach you VIVA, but this time around I am going to concentrate on drugs, medication. So during VIVA, you may be asked to identify some things, to identify medication or instruments, but this time around I've done some videos on instrumentation and then other items, so you can do yourself well to go back to my videos and check for other instrumentation during VIVA. So today I'm going to concentrate on medication. Now, if you're asked during VIVA that you should identify some medication, of course, the examiner may just place this different types of medication or instruments in front of you, and then you will be asked to identify them. Let's take, for example, this is specimen A, B, C, and D. And of course, we have different classes of medications here, right? This might be antibiotic, this might be antipyretic, this one may be any group of medication that you have, antipsychotic medication, antipyretic medication, whatever the medication is, so you should identify them. So, for this video is for you to get it right during VIVA. After identifying, of course, the first thing you would do is to identify the medication. So for example, you may take this one and say that this is what? This is metronidazole. Each medication has three names, right? The generic name, that is metronidazole. This one, most generic names are, that's this small writing that you see below the bold writing, and this is a company name, right? Metronidazole, that's the generic name, right? The generic name, most times is written small like this with tiny, the font size is being reduced. So this is the company name, and then it has brand name, right? Like let's say Emzo, isn't it? Let's say Emzo. Emzo is what? It's a brand name, isn't it? So they have their company name, and they have under the brand name, let's say Emzogil, for example, and under it you will see what? Metronidazole. That is the generic name. So first of all, what you are going to tell the examiner is that for this medication, it's metronidazole. Always try to mention the generic name, right? It's metronidazole, but for this company, Avrogil, right? Avrogil. So somebody will ask, what is Avrogil? And I don't know what Avrogil is. So during examination here, during VIVA, it is important for you to identify this as what? Metronidazole. Always, do not forget, always remember to call the generic name. And the generic name, most times, it comes under this, under the what? Company name. Do you understand? And see this one also. So I have what? Oxytocin. See, we have what? Laptocin here. That's the company name, right? Laptocin. But the real name, the generic name is what? Oxytocin. Isn't it? So as you can see, this is oxytocin. And it is written here also what? Metronidazole. So the company name also always is written boldly, while the generic name is always, most times, is always under the company name, right? So we have identified these two medications, isn't it? So during VIVA, identify the what? The specimen. Like this medication now, we have identified it, right? When identifying, always take, as a student during VIVA, right? Take the medication container and read. Read it. That is how you will be able to know the company name and the generic name, that which I have identified earlier, right? So after identifying, of course, the examiner may say, can you tell us what's the adult dose or pediatric dosage? So kindly again, look to the what? Look at the container, right? Look at the container of the medication. Of course, you will see 400 milligram. This medication comes in what? 400 milligram and 200 milligram for adults, right? 400 or 200 milligram. So how did you serve the medication? It can be 200 milligram in divided doses, right? You can tell your examiner if the adult dose is what? 200 milligram in divided doses, right? It can be 200 milligram TDS for adults, isn't it? So it is important that you pick up the medication, the container. So the examiner is trying to know Do you have the ability to be able to what? Identify or read your medication so that you can administer the right medication to the right patient? So imagine now, for example, during VIVA, the examiner may decide to what? Place a plain container, like no label on it, nothing, and ask you, identify this specimen. You will be right to tell the examiner, ma, sir, I cannot identify this because there is nothing written on the container. Of course, you are right. So the examiner is trying to achieve whether you can be able to identify, to read, identify the right medication. Remember your 5 R's. Identify the right medication to the right patient, isn't it? So if you can be able to read it, that means you identify the right medication, isn't it? You read what is on the patient prescription, and now you have identified the right medication by taking and reading, right? So you have, after doing that, and that's all. The examiner may also ask you another question. The examiner may ask you pharmacokinetics, pharmacodynamics, or nursing responsibilities if you are administering metronidazole. So don't worry, I will do nursing responsibilities on medication on my next video. So again, you are asked to identify all this medication, then you pick the next medication and put it at eye level and say that this is what? Oxytocin injection. So the company name is Laptocin, while the generic name is Oxytocin. It is important also, as always, as I mentioned earlier on, to mention the generic name. So what class does it belong to? So for metronidazole, this belongs to an antibiotic class of medication. It falls under antibiotics, and then under antibiotics it falls under antimicrobial. So the examiner may ask you, what class of medication does this belongs to? Then you'll be able to tell the examiner antibiotics, and it falls under antimicrobial. I hope you understand. And then the next medication, the examiner will also ask you, what the class of this medication? After identifying the generic name, oxytocin, the next is what? Class of medication. And as the examiner continues, she will keep asking you questions. So you pick up this one and also say that it's an oxytocin injection. Of course, she may ask you, what is the function of this medication? Yes, some examiners can do that. What is the function of this medication? As you answer the question, the examiner keep coming up, probing with other questions, right? So you can identify the next specimen as the examiner warrants you. So I hope this video is helpful for VIVA, and I hope you like this video. Thank you for staying with me till the end of this VIVA medication identification. Thank you. I hope it's helpful during your VIVA. So do not forget to share and make comments. Thank you. Bye-bye.